Hello friends, I hope you are doing well. Today we will discuss another important communication topic for MRCPCH clinical examination. Suppose you have been told to do the counseling to a mom whose child is having a murmur. How do you approach? First, introduce yourself, greet the mom, and congratulate the mom for the baby. And then start the discussion asking if anyone wants to join in the discussion, and ask mom, what is your understanding about it? Suppose the mom is having some previous concept, what is murmur, that also help in the discussion. Otherwise, you can start your discussion by signposting. Today we are going to discuss your baby's condition. Your baby is having a sound in the heart that is called murmur. How this sound is produced? Because baby's heart is beating much faster than us. That's why, and this high velocity blood is coming through the narrow cavities of the heart, that can cause some turbulence. That's why the murmur is happening. Most of the time it is innocent murmur, so it is getting improved over time. So we will check at 24 hours of life if the murmur is still persistent. Then if the baby remain well, then the GP will follow up in few weeks time, or else we will arrange the consultant follow up, and if required we will consider a scan, GLE scan of the heart. We call it echocardiogram. And sometimes this murmur can be happening because of some congenital causes. So first of all, it could be PDA. You can write and draw the diagrams how the PDA or any other clinical abnormality like VSD, SD, whatever the condition is relevant. But don't try too much details in it. You can consider the PDA, and it is resolving over time. It's a physiological thing, and sometimes it may persist. So most of the babies improve over 24 to 48 hours. And give the safety net advice, which is very important. I've always to ask mom, if you feel that your baby looks very dusky, pale, or not responding to you, or not gaining weight, drench in perspiration while having the feeding is not good, or recurrent chest infection. These are all the signs of heart failure. So contact us immediately if you feel anything abnormal about the baby. And after the discussion, you just signpost that you can summarize that yes, today we have a discussion about your baby, and I can offer some information leaflet, which is very helpful. If you are not happy with the discussion, I can bring my consultant to have the discussion with you, and always offer help if mom has any concerns or any questions. And just conclude the discussion by saying this: thank you very much for participating this discussion. So this is how you should approach. And the main suggestion that I want to give you: always use pen and paper to draw the diagram, make them understand what is going wrong with the uh, baby, or is just the innocent thing. So that's how you should approach. You are doing these things every day, this discussion and everything. Try to be relaxed, try to be interactive. Ask the mom to speak more rather than do the monologue. So always give the opportunity to speak the other side of this table, and just address their concern, questions. And always, after doing the discussion, after breaking the glass, always recheck with their understanding whether I'm comprehensible to you, whether are you with me. These are the small phrases that can help to build up the rapport, as well as a good way of communications. So after finishing, then you should move on to the next station. If you commit any mistakes during the discussion, don't think about it. The main focus is, once the station is over, don't think about the station, move on to the next station. That's the top tip of the day. Thank you very much. See you in the next video.